Morning, everybody. As Alan said, my job title is slightly impenetrable. I have a sort of commercial responsibility within Pfizer to look after our primary care medicines portfolio. But perhaps because of my NHS background, I also lead nationally on our NHS partnership strategy. And it is that partnership working that I wanted really to focus on today. I just wanted to pick up a couple of things that colleagues on the panel brought up. And Alan has said the environment is changing. He's mentioned the possible future role of the commercial sector. We're on a real journey with this. Traditionally, we've been very much down in that sort of the treatment, the hardcore treatment end of healthcare. We recognise that healthcare is changing. We aren't the answer to everybody's prayers, but I hope by giving you some examples of the kind of ways that we can work and add value in the NHS, that we are maybe a piece of the solution, not so arrogant as to, to presume to be the solution. I certainly don't think anybody would describe me as the answer to their prayers. Perhaps my wife, maybe. I was also struck by the imagination to progress. I think that's crucial. So one of the things I'd really hope that you sort of are sort of sat there thinking, I want to be open-minded. I really want to understand. We have some masterclasses running today. See perhaps beyond the title of those about what the specifics were and what the kind of partnership sharing work that we could do for you in the things that you're trying to achieve. So all of that said, let me talk a little bit about sort of what I wanted to do is share just a bit of thinking about why I think partnership's important and what I mean by partnership, what we mean in Pfizer by partnership. And then where this really comes to life, I think, is with a few examples, so which is what I'll spend most of the time talking about. So up there, big sea of faces, doctors, nurses, patients, healthcare professionals, colleagues from allied industries, directors of commissioning, public health doctors, all trying to work sort of in the same space. Doctors are trying to find, nurses trying to find ways to give the right treatment, the right intervention to patients to give them the best possible outcome that patient is potentially able to achieve. In the context of that, there are lots of people who are working, as Alan described it, at the system level, who are trying to enable that, but are confronted by this very significant constraint on public spending. I look up there, I see Pfizer colleagues. What are they trying to achieve? Well, they're trying to hunt down revenue. Let's be honest about it. But they're trying to do that in a responsible and sustainable way for the future. And if you take those things, I guess, in isolation from one another, they can appear to be sort of in opposite tension. Where one begins to do well, you can begin surely somewhere else that it's going to cause a problem. And this is why I think partnership's important, because that tension is going to exist, and I believe, unless we can find mutually beneficial ways to work together. So that's why I think partnership is important. Having said what I'm going to talk about what partnership is, from the pharmaceutical industry point of view, this is my personal perspective, this is what partnership isn't. Too much of the relationship between the industry and generally the NHS has been characterised by what I would describe as a blank cheque. Who's this going to? How much money is being transferred? What's it for? Who's signing it off? This is not what Pfizer would describe as partnership working with the NHS or the wider health system. This is not how we want to work. It's not how we do work in our partnership projects. So, what is partnership? For me, to put it crudely, I guess it's about having the same skin in the game. It's about shared risk. It's about shared investment. It's about shared benefit. Having that honest conversation about what's in it for me, what's in it for you, what's acceptable, what's not, and getting that out on the table early. Then you can begin this bottom right-hand graphic, that piece of white light in the middle of those circles, is all about mutual benefit. If you can find that space to work in, you can be completely transparent. And when you're completely transparent, you have a solid foundation to build trust from. And this model, which I'll just flick onto, is exactly how when we're talking with NHS colleagues, when we're talking internally, this is how we describe our approach to partnership. To give you some examples, if the slide will advance. So projects, work that we do, any investment that we make, whether it's money, whether it's individuals and expertise, it must demonstrably be there to improve patient outcomes. It must have a way of optimising NHS resources. This is easy to say, it's not necessarily always easy to deliver, but working together, I believe that you can begin to nut these things through. Increasing value to Pfizer, being completely transparent about it. We do stuff that's about recognition. We do stuff that's about reputation. But I believe by being a good partner, if you're delivering against all of those three things, for us, it will deliver increased revenue longer term. And that's important to us as a private sector company to return that value to our shareholders. But it is also, if we're doing this right, that we are delivering benefit to patients and we're delivering benefit to the NHS as well. All of that's a bit conceptual. So let me just try and illustrate that with a few examples of where I believe this has gone well. This is NHS Havering is a PCT sort of most of the way to Essex on the outskirts of London, if you're not from London. This is a project that we worked on with the local stop smoking service, with a COPD consultant and public health. The situation in Havering, I hope you can read that, the higher than average death rate from smoking, lots of emergency and medical admissions associated with COPD, lots of excess bed days, and a higher, not unsurprisingly, a higher predicted prevalence of COPD than observed. So the missing million, some of you may be familiar with that term in public health. So the opportunity we saw here was, is there a way to bring COPD services together with the local stop smoking services to see if you can find more of those missing millions, people who are not having their disease adequately managed and are turning up in hospital? And can you, through that screening process, motivate people to quit? So to drive up quit rate. Very important public health issue. It is, I acknowledge, down the screening and treatment end rather than, you know, the sort of tobacco control end. What did we do? Joint project group and of all of the parties co-wrote the business case, equal investment from both parts, very important piece that for us, that we aren't just putting money in. We put expertise in, audit and analysis, project management, training that we commissioned. Significantly, all of the clinical leadership came from the NHS. The managerial backup, or pieces of the managerial backup came from Pfizer, but the clinical leadership from the NHS. What happened? Small pilot, the numbers are small, but if you imagine this was through 7 pharmacies, you imagine this scaled up, you know, for 100 community pharmacies in a PCT, the numbers are bigger. 35 people found from 123 screens, 33% strike rate, that's not bad. 7 of those with severe COPD, who have now been referred for treatment and are being treated. So that's you're finding people who are, you know, having their diseases unmanaged at the moment, and really significantly using that screening process of an abnormal lung age, quit rate, the same advisors, that quit rate went from 48% to 65% and maxed out at 75%. That's a massive win for patients, a massive win for the NHS. And let me be very explicit about that's sort of the summary, I guess, for patient and for the NHS. For Pfizer, reputationally, we have a much improved working relationship with the PCT. It's generated new initiatives for us. And there has been an increase, according to local guidelines, in the use of Pfizer medicines. And to make that absolutely real, about 1 in 3 people get a Pfizer medicine who choose to use a medicine to stop smoking. 126 people, 1/3 of those, 40 new people. So there's a win for the NHS there, there's a win for Pfizer, and there's a win for the patient. You're much more likely to give up smoking through that service. So I think that's an example. Here's a larger scale example. I haven't got time to go through it in detail. This is a project called Enforce. It was a multi-company whole PCT project, again in COPD, massive public health issue. And I'm not embarrassed to put 2 of the same type of thing up there. The purpose of this project was to see if you could genuinely collaborate to reduce the number of emergency medical admissions winter 2008 to winter 2009.